myself to chair the next session. Xin phép được mời bác sĩ Scott Philip và bác sĩ Trần Huy Nhật là tôi được chủ tọa của phiên tiếp theo.
Good afternoon, everyone. And today I will talk about mercury poisoning. I will share about the background of mercury poisoning regarding the toxicokinetics and clinical manifestations. And after my talk, Dr. Vanessa will share her experience in mercury poisoning with the cases. I do not have conflicts of interest, and I think that you know about Minamata disease before. Like Minamata disease is the well-known mercury poisoning that resulting from methyl mercury accumulated in the base marine life, and people ate the fish or shellfish and develop severe neurological effects. And this is the other outbreak of organomercury poisoning among Iraqi farmers, resulted from the consumption of the bread that prepared from the wheat or barley that contaminated with a mercurial fungicide. Mercury has the atomic number of 80 and with the weight about 200, boiling point at 357 Celsius. There are three forms, elemental. For example, the quicksilver, that the silver color liquid that is in thermometer or sphygmomanometer. And the second one is inorganic mercury, like mercurous ion, mercury ion. And the last one is organic mercury, including short-chain acyl mercury compound like methyl mercury, long-chain mercury, and aryl mercury compound. The sources of mercury, like for elemental, you can find elemental mercury in thermometer or sphygmomanometer, or in the dentistry for dental amalgam that is used by the dentist in the past. And for inorganic or mercury salt, you can find from the unregulated cosmetic products, especially skin lightening products, chemical laboratory, pattern batteries, or vinyl chloride manufacturer. And for organics, mercury, the source can be like contaminated seafood or manufacture of the fungicides or even pesticides. So you can see that all forms of mercury are used for industrial purpose and medicinal purpose and for food. As you see from inorganics, inorganic mercury is used in Ayurveda or Ayurvedic herbal medicine. Recently, we published the case reports in dental workers. We report 2 dental workers who had elevated urine mercury levels during routine health screening. Their previously mercury tests were normal and they don't have any symptoms. And you can see that from the past, their urine mercury were normal, but increased to 37 and 25. And because of working in the dentist area, so we explore the cause of elevated urine mercury, and we found that they use the facial cream from the same company. The facial cream are unregulated and contains a lot of amounts of mercury. They use facial cream for to brighten their face because they are whitening cream. Mercury inhibits the productions of melanin, so it is in the cosmetic, especially the whitening cream formula. So even they were together in the dentist department, dental department, but finally we found that they use the cream from the same brand that contains mercury. So you have to ask more about the food consumptions or the product that they use during the daily life. And this is the other case that was reported and referred to our Poison Center for consultation by a 73 years old female with cervical cancer, but her treatment was complete for all full course of radiation therapy. But she developed abdominal pain, and her relative gave her the liquid mercury obtained from a monk in the temple, believing it could help her illness. So after she ingested mercury, she passed mercury in her stool, and her relative told her that it exhaled the illness that you saw, she saw the mercury in her stool. She did not have mercury poisoning. So another exposure, it can be from injections intravenously, that you can see the deposit of mercury in the lung and in the injection site. So for toxicokinetics, all forms have different toxicokinetics, and they are transformed inside the mammals or in the human body. I will explain more. Like the first one, elemental mercury. The primary route of exposure is inhalations. Negligible is absorbed from the normal GI tract, usually considered non-toxic when ingested. So you can see in the previous case before that the patient ingested elemental mercury every day but did not have the poisoning, except if that patient had abnormal GI mortality or massive injections or anatomic GI abnormality, it can cause poisoning from injections. And after absorptions via the inhalations, it distributes to the CNS, that it changed to mercury cation, and it accumulates in the CNS, and it can be delay in absorptions in the CNS, and finally it accumulates in CNS and cause the poisoning from elemental. The poisoning caused by the inorganics, mercury, and it is eliminated mainly by the kidney and GI, so that you can find the mercury from the urine. For the inorganics, the primary route of exposure is oral, but it can be absorbed across the skin and mucous membrane, vary by concentrations, skin integrity, and lipid solubility. And after absorptions, it will distribute to the blood right, for transiently and acutely. And then the greatest concentrations is found in the kidneys, especially in the renal tubule. And because of the low lipid solubility, so it penetrates the blood-brain barrier poorly. But from the slow eliminations and prolonged exposure, it can contribute to significant CNS accumulation. So CNS will be delayed. It is eliminations mainly is kidney and GI, so you can find inorganic mercury from the urine. And for organic mercury, differently from each compound, right? The primary route of exposure is injections or oral, and it can distribute to CNS, kidney, liver, blood, and hair, and it clear via GI route, so no kidney route, so you cannot find organic mercury much in the urine. For short-chain acute mercury compound, it is well absorbed from the gut, and it has stable carbon and mercury bond. So it converts to inorganic mercury compound at a very slow rate. So, and because of lipophilic, it can distribute to all tissues, including blood-brain barrier and placenta, and can cause devastating neurological degenerations that you can see in the Minamata disease. And for aerial and long-chain acute compounds, it absorbs via GI tract more than 50%, but they have a very balanced carbon-mercury bond. So it is subsequently cleaved and releasing inorganic mercury ion. So the toxicity or poisoning of aerial and long-chain acute compound is comparable to inorganic mercury poisoning. For pathophysiology, mercury binds to the sulfur and replace hydrogen ion in sulfide groups, react with phosphoryl or amide groups, resulting in widespread dysfunctions of enzyme, and bind with sulfide groups, affecting a lot of number of enzymes inside the body. Mercurial or salt poisoning or inorganic mercury can cause necrosis of GI tracts and renal tubules. And methyl mercury poisoning can cause severe neurologic manifestations, like I mentioned before. So mercury exposure effects can cause, can affect many organs inside the body, especially GI tracts, CNS, and kidney, and renal. For the clinical manifestation, the first one, elemental mercury, because the primary route is inhalation. So from acute inhalation, it will have the effect at the pulmonary site. It occurs within hours of exposure, cause cough and maybe develop ARDS, and it also can cause GI symptoms like nausea, vomiting, diarrhea, gastric test, dysphagia, weakness, visual disturbance. The chest X-ray can show interstitial pneumonitis or atelectasis. And following the metabolism to inorganic salt, so it can cause inorganic mercury toxicity as tremor or renal failure. But it does not enter CNS and cross placenta for elemental mercury. And swallowing elemental mercury, that sometimes the thermometer is broken and the infant or the toddler might eat the elemental mercury inside. They did not produce any adverse effects unless the mucosa is damaged. But from injections intramuscularly, it can cause abscess and granuloma formation. And intravenously, this can cause pulmonary and systemic emboli. And for inorganic mercury, the main route is ingestion or oral exposure. So it can cause severe irritant to caustic gastroenteritis, grayish discolorations of the mucous membrane, oropharyngeal pain, nausea, vomiting, hematemesis, hematochezia, like severe GI symptoms, and massive loss that resulting in shock and AKI. And for chronic exposure, the main clinical symptoms, the hallmarks of neurologic toxicity include like tremor, neurasthenia, or the sense of like fatigue, depression, difficult concentrating, erythema, that behavioral changes, right, shyness, emotional variability, and chronic renal toxicity, like proteinuria to the nephrotic syndrome. And acrodermia is well known or reported in the past in the small children as pink disease, that is like the generalized rash, edema, and erythema of the palm, soles, and face, together with other symptoms like irritability, photophobia, nausea, tremor, and weakness. This is the case report of the pink disease that mimic Kawasaki. The rash, erythema at the palm and sole. Like this case, the infant has been given a mercury-containing teething powder, but I think that now stop using mercury-containing teething powder, so pink disease is reported rarely currently. So for organic mercury, differently that you can see like short chain AQ or methyl mercury. Methyl mercury produce almost purely neurologic disease, usually permanent. Around period can be like weeks to months, and oral facial paresthesia is a common initial symptom followed by headache, tremor, and fatigue. In severe cases, the patients can develop like muscle rigidity, spasticity, blindness, and numbers of neurological symptoms. And migraine symptoms or renal and pulmonary abnormality can develop also. And for short chain AQ, the same, that the infant often born to mother with little or no manifestations, but they expose prenatally to methyl mercury, and this affects the CS in the of the newborn, like in Minamata disease. And for longer chain AQ and aryl compound, they are transformed into inorganic mercury ion. So the toxicity closely resembles to inorganic mercury toxicity. For the diagnostic testing, you have to consider about mercury poisoning if you see the patients with unexplained neuropsychiatric and kidney abnormality without any other explanations. Mercury poisoning might be one of the differential diagnosis, especially if the patient are at least like occupational exposure or access to mercurial product that you have to ask about like the history before. And during mercury determinations can help confirm exposure or monitor the efficacy of chelation therapy. But for all forms except like only short chain AQ, a 24-hour urinary measurement after a 5-day seafood-free diet is recommended. Because even in our lab in Ramadi Hospital, we use ICP-MS to measure mercury, but the lab doesn't classify the inorganic and organic mercury for us, because they say like it's quite difficult and harmful for them to do. So we can measure only like all form of mercury. So you have to let the patient have the seafood-free diet for at least like 5 days. And most unexposed individual, the urine level for 24 hours should be less than 10 to 15. However, the level correlates poorly with the toxicity and is quite difficult to distinguish from the poisoning. Most using only like confirming exposure or following in the following effects of chelation therapy. And for whole blood, mercury concentrations reflect intense acute inorganic mercury exposure. And for organic mercury, because it is eliminated predominantly with fecal route, so you have to use the blood concentrations. The urine concentration is not useful for organic form, especially like methyl mercury poisoning. So like this, for elemental and inorganic mercury, you should measure the mercury in 24 hours urine level. But for organics, you should measure in the whole blood. And mercury can accumulate in the hair, but the reliability of this method, like in the hair, is questionable and not recommended now. So I think mainly, but now we measure in the urine. For the general management by initial assessment and stabilizations are the main treatment. And another one that you have to find the source, the exposure and terminations of the exposure is quite very important. Supportive care and perform like baseline diagnostic studies, including like CBC, blood chem, or some might measure like beta 2 microglobulin to see the proximal renal tube abnormality and monitoring. For elemental mercury, if the patients aspirate the metallic mercury, some might recommend like postural damage or endotracheal suction. And for injection, right, subcutaneous or IM or IV, I think that you should find that from the X-ray. If you can find the deposit of mercury, you might consult the surgeon for surgical excision if it's possible to remove those mercury. And for environmental decontamination by elemental mercury, that is in the thermometer sphygmomanometer, if it's broken, and elemental mercury gets spilled onto the solid surfaces, it should be absorbed to the sand and mixture and swept into the tightly sealed container. And for adsorbent surfaces by carpets, it should be removed and discarded in the proper way or proper method to eliminate the mercury. And spilled mercury compound should not be vacuumed because it could volatile mercury and increase the absorption. And for inorganic mercury fluid resuscitations that you see, the clinical manifestation is can cause severe GI symptoms, GI bleeding, and can cause a lot of fluid loss and AKI and hypovolemia. So resuscitation is important. And for organic mercury, aggressive decontamination for acute injections or renal exposure might be concerned. For chelator, the thiol groups of the chelator compete with the endogenous sulfide group for the binding of mercury. So they prevent the inactivation of sulfide containing enzyme. And the indication is the history of significant mercury exposure together with the typical symptom of mercury poisoning. And you can measure either blood or urine mercury help support in unclear cases or guide the duration of treatment. For elemental mercury and inorganic mercury, the chelators include like dimercaprol and in some cases succimer and DMPS that is available in Europe. And for organic mercury, dimercaprol is reported to exacerbate the CNS symptoms, so only the succimer the most reasonable treatment for methyl mercury now. So if you can see that for the therapy, right? Elemental and inorganic mercury, you can use or succimer, but for organic succimer only, especially in the early phase. So in conclusion, there are mainly 3 forms of mercury that are different toxicokinetics, different clinical manifestations in some way. Like elemental mercury you can find from like battery, thermometer, manufacturers, sphygmomanometer, and dental amalgam that no evidence now support that amalgam can cause like mercury poisoning. And for inorganics, you can find from unregulated cosmetic products, especially skin lightening because it inhibits the production of melanin, chemical lab, and some herbal remedy or herbal medicine. For organics, it can be found in like contaminated seafood, manufacture of drug or some pesticide. The lab for elemental and inorganic, you can measure mercury in the urine, but for organics, the whole blood is the better. And for the treatment, find the exposure, find the soft exposure. Chelator is used only like significant mercury exposure together with the symptoms. So that's all for my presentation. Thank you.